One of the most common questions I get about shoulder replacements is, what is my weight bearing limitation after shoulder replacement? And that's a great question. Initially, for the first 3 months, I don't want my patients lifting much more than 2 pounds. Between 3 and 4 months after surgery, you can go up to about 10 pounds, which is okay. After 4 months, you can lift up to about 25 pounds routinely. And I tell patients that's 25 pounds per arm. And a lot of that is mostly overhead that I'm worried about. So you think about that, you're really lifting a suitcase, putting it up into the overhead compartment of a plane. I don't want that suitcase more than 50 pounds because that's 25 pounds per arm lifting that up. If you're doing heavier activities after a shoulder replacement, I tell my patients, if you're able to tuck your elbows in, you're able to engage your chest muscles, your back muscles to be able to help with some of that strength, that's very helpful. 25 pounds per arm repetitively overhead is usually what I tell my patients. That's not necessarily applicable for everybody. Some patients are able to go a little bit higher. Some patients don't choose to go that high. But you think about a shoulder replacement as wear and tear. So similar to what you had in terms of arthritis coming in, it is metal and plastic that's in your shoulder. So we want to preserve the longevity of that. Repetitive lifting that's stressful on the shoulder may mean that the shoulder doesn't last as long. Occasional lifting that's a little bit heavier may be just fine for that shoulder. So every patient's a little bit different, but I think mechanics and understanding your limitations is very important in terms of weight bearing after shoulder replacements.